Hello, my name is Stephen Lightfoot and I'm the Chair of NHS Sussex. And what I'd like to do today is to give you a very short video summary of our board meeting held in public here in Lewes on the 29th of January. Now, we started with our Chief Executive report, this time for the first time from Mark Smith, who's actually taken over from Adam Doyle, who's now gone into his NHS England role on a full-time basis as National Director for System Development. We thank Adam for all he's done for us over the last 8 years and wish him well in his new role. Now, as far as NHS Sussex is concerned, Mark actually started with the Chief Executive's report, where he provided a really good summary of how things are working during our winter period. We know that services are very busy, but they are coping. And I think that's a great credit to the team that have been involved in doing all the planning and preparation for that. I think also there's a series of other really good achievements that the system still feels it's making progress. So the transition from Adam to Mark has been a lot of continuity. Now, in terms of going through then the rest of our board business, there's a series of assurance committee reports, which are really important to get assurance from each of our board committees that look at individual areas of performance. Now, I think it's fair to say that we've got a number of performance challenges in our system. So we know that there's challenges with discharge out of hospital and getting people to home as quickly as possible. We know that there's a challenge in terms of our financial sustainability, and we're working our way through that in conjunction with our system partners. But there are also some positives. I think we've got record numbers of GP appointments being delivered by our primary care colleagues, and there's actually been an increase in the number of GPs in Sussex as well. I think what we're seeing is an improvement in our urgent and emergency care services, and so we've got a good, strong upper quartile performance compared to other systems in the country. That's not to say that the services are not busy, but actually compared to other parts of the country, we're doing pretty well. I think also our planned care waiting list is also coming down. It's still too high, we've still got work to do, but the reality is I think we are making good progress by working together as a system. I think another area of important report today was from our Freedom to Speak Up Guardian. This is something that we do in the NHS where it's an independent individual that staff can go to if they've got concerns. And I think it's really important at a period of intense change that staff feel free and safe to raise issues that they can't necessarily raise with their managers. And I think what we saw today was a really good progress in terms of establishing and embedding freedom to speak up as a process and as a guardian in NHS Sussex. And also we saw the plans for how we're going to introduce that in primary care. We obviously discussed about our approach to planning for the new financial year starting on the 1st of April. At the date of the meeting, we're still waiting for the planning guidance from the national team, but our system has been working together to develop the plans in advance of that. We had a really thought-provoking paper on clinical outcomes for cardiovascular disease. And that was a really important session because cardiovascular disease is still the major cause of death in the system, as it is in many other places too. And so in terms of being able to ensure we've got an approach to prevent the development of cardiovascular disease, that feels like an important investment opportunity for the future. So the board endorsed the approach, but we've got to work through the planning process in terms of how much we can afford to actually invest in that. We had a really good paper on our Sussex Health and Care People Plan, and I think actually there was lots of really good examples of how we're recruiting, we're retaining and developing our NHS staff, which are the lifeblood of our organisation. We obviously took time to discuss our corporate governance items, and they included looking at our board assurance framework risks and making sure we're mitigating the key risks to delivery of our strategy. And also we approved some updated policies as well on important areas such as conflict of interest, fraud and standards of business conduct. I then talked about a chair's report from myself in terms of some of the other activities I get in terms of wider system partnerships involved in the health and wellbeing boards, but also in terms of the economic growth boards related to our fourth core purpose as an integrated care board, and also on research as well. I think there's no doubt that as a board we are committed to improving services both in the short term but also in the long term through the delivery of our Improving Lives Together strategy. So I think that was a good progress update. Thank you for your interest, and our next board meeting held in public will be on the 26th of March in Burgess Hill. Thank you and see you next time.